The urinary system is comprised of the kidneys that filter blood and produce urine, the ureters, which conduct that urine to the urinary bladder, which here is seen inferior to our uterus. So the urinary bladder is here. This is a temporary storage site for urine, and then it will be conducted out of the body through the urethra. So this is our kidney, and again it is filtering blood and producing urine. When blood enters the kidney, it enters through the renal artery, which branches into segmental arteries. The segmental arteries branch into interlobar arteries, which branch into these arcuate arteries that run parallel to the surface of the kidney. The arcuate arteries branch into interlobular arteries. The interlobular arteries give rise to our afferent arterioles that enter the glomerulus so that blood can be filtered. So the afferent arterioles will enter this renal corpuscle. The glomerulus will be the site of filtration. The blood will exit through efferent arterioles and enter our peritubular capillaries or our vasa recta capillaries. Nutrient and gas exchange will occur. Our vasa recta capillaries are going to be really important in setting up our osmotic pressure gradient, and from there this blood will then drain into our interlobular veins that drain into arcuate veins that drain into interlobar veins. There are no corresponding segmental veins. Our interlobar veins just drain into our renal veins. So that's the pathway that blood follows through the kidney. Let's follow the pathway of the fluid that's becoming urine. So in the glomerulus, we are filtering blood and producing what's called filtrate that's collected in our capsular space. So the filtrate will move into what's called the proximal convoluted tubule. This is where most reabsorption and secretion occurs. So as soon as we start doing things to the filtrate, it's not the same composition as filtrate in our capsular space, so we could now call it tubular fluid. The tubular fluid will pass into the descending limb of the nephron loop, which turns and then the fluid will pass through the ascending limb of the nephron loop, drain into the distal convoluted tubule, which is under hormonal control, and then be conducted to the collecting duct, which is where we'll have our final reabsorption of water and concentration of wastes. So as the material is passing from the glomerulus through the rest of the renal tubule, it's considered tubule fluid. In the collecting duct, it is still tubular fluid because we're collecting water and it hasn't yet reached the composition of urine. When we get to the very distal portion of the collecting duct, we reach these little ducts called papillary ducts. When the tubular fluid hits the papillary ducts, we can no longer pull back any water, so it would then be urine. Urine is then collected in our renal papilla, which drain into our minor calyces. Our minor calyces merge to form a major calyx. Our major calyces merge to form the renal pelvis, and the renal pelvis conducts urine away through to our ureter. Other aspects of renal anatomy that we should be aware of are its composition. So the kidneys are retroperitoneal, meaning they sit outside the peritoneum. That protects all of your abdominal organs. So they have 3 layers of connective tissue that protect them. The renal fascia, the perirenal fat pad, and the fibrous capsule. So the outermost layer of the kidney wall is the fibrous capsule. Then deep to that we have our renal cortex, which is parenchymal tissue that contains our glomeruli. So this is all renal cortex. The renal cortex pokes down into this region called the renal medulla in what are called renal columns. Our renal columns separate our renal medulla into renal pyramids. So this is a 3-dimensional structure of a renal pyramid. Our renal pyramids drain into our renal papilla, which then take our urine away from the kidney. So things that we can see, again, are these renal columns, which is cortical tissue that is separating our medullary tissue into renal pyramids. Again, we can see the blood flow coming in and exiting, and we can follow the pathway of urine production from the cortex to the ureters.